A century ago, there was very little doctors could do if you had heart disease. You were doomed to bed rest, and usually much worse. But some people believe scientific research could provide answers and hope. Among those believers were the 6 doctors who founded the American Heart Association on June 10, 1924. Heart disease was the leading cause of death. Yet, as co-founder Dr. Paul Dudley White said, it was a time of almost unbelievable ignorance. The fight against that ignorance took a major leap forward in 1948 when we became a nationwide voluntary health organization that funds world-class research. Our life-saving mission became much more visible as volunteer and fundraising events took hold in communities and businesses around the country. Since then, thanks to millions of volunteers and supporters, we've impacted countless lives. We've helped people prevent disease, eat healthier, get active, enjoy healthier environments, learn life-saving CPR, and access improved health care. All our efforts are rooted in science. In fact, we fund more heart disease and stroke research than any organization except the federal government. We funded 13 Nobel Prize winners. We funded research breakthroughs in CPR, the first artificial heart valve, cholesterol-inhibiting drugs, and heart transplants. In 1998, we launched the American Stroke Association, bolstering our commitment to fighting this deadly disease. We serve all Americans, but over the years, we've focused on at-risk populations. For example, we help women understand heart disease is their greatest health threat, and we help raise awareness of increased stroke risk in the African American community. We've remained a steadfast leader in the fight against childhood obesity, and our community programs, cookbooks, and healthy living resources are empowering families to make better choices. The American Heart Association is the nation's leader in CPR science, education, and training, teaching this vital skill to millions every year. Our dedication to patients has never wavered. We've developed science-based guidelines so healthcare professionals can treat patients based on the latest research. And we help hospitals nationwide follow those guidelines and improve emergency care for heart attack and stroke patients. One of the most important ways we help patients is by expanding scientific knowledge. Our many scientific conferences share the latest and best research with thousands of healthcare professionals. Our largest meeting, Scientific Sessions, has been held every year since 1925, except for a brief hiatus during World War II. And our 12 scientific journals share the latest and best developments in heart disease and stroke. Since 1981, we've worked with federal, state, and local officials to change policy and build healthier environments. Changes like banning smoking in public places, making sure kids get healthier school foods, and removing trans fats from foods. What's the result of all this work over the years? Exactly what we hoped. Deaths from heart disease and stroke have fallen steadily since the 1970s. Now, with fewer people dying, we have stepped up our efforts to help everyone live better by building a culture of health. We're doing that by working toward the ambitious goal of dramatically improving the cardiovascular health of all Americans by 2020. The American Heart Association's life-saving work continues today, stronger than ever, thanks to millions of dedicated volunteers, brilliant researchers, and passionate supporters. And we look forward to the decades ahead. Just like our founders did 90 years ago, we know we can continue to improve lives and save them.